Good morning, everyone. My name is Pablo Kurzan, and I studied Venezuelan sex workers in Bogota, forced displacement, and health delivery. I was advised by Dr. Carrie Preston, and her support was vital throughout my Keystone journey. So, quickly, I'm going to read my need statement here with you guys. There's a need to understand Venezuelan sex workers' access to healthcare and analyze how the legal and societal paradigms in Bogota impact the quality of care in order to better tailor policies, interventions, and support services for sex workers. So I'm gonna give a little background of what's going on in Venezuela. Here I just put some statistics so you guys can kind of get your minds around the context of the country right now. And basically, there's been a corrupt government for decades. There's been mismanagement of the oil industry and countless human rights abuses. Many Venezuelans have migrated to countries all over the world, but ones with the least means walk to neighboring countries, primarily Colombia. And here we see a couple pictures of people crossing bridges through Colombia and on their way. So a lot of them go to Bogota in search for work, and there's at least 330,000 Venezuelans in Bogota, and many of them arrive by foot, as I said, and most of them are unregistered. Bogota has always had high unemployment, especially in their informal economy sector. And the stress imposed by these Venezuelan migrants has completely saturated the labor market. And many Venezuelan women have chosen sex work as their only viable employment option. In Bogota's red light district, the Santa Fe district here in the upper middle in red, 70% of the women are Venezuelan, 50% of which are between the ages of 18 and 25. So the question becomes, how are these women protected considering their precarious occupation and their unregistered status? So before I dive into that, I kind of want to talk about the legal frameworks that motivate sex work policies around the world. There's three major ones: prohibitionist, abolitionist, and regulationist. So prohibitionists believe that sex work is a social evil and should be eliminated in any way. They criminalize the sex workers, they criminalize anything related to sex work. Abolitionists believe that you should criminalize things related to sex work, but not the sex workers themselves. They criminalize brothels, they criminalize pimping. They believe that sex work is inextricably tied to sex trafficking, and they don't want to victimize the sex workers. And regulationists believe that sex work is a legitimate way to earn an income, and they regulate it using licensing, zoning, and mandatory health checkups to curb the negative side effects. In Bogota, sex work is only tolerated in the Santa Fe district, and sex workers must carry health and identification cards. Sex workers who work outside of these zones could be fined and are acting illegally. So although this seems regulationist, the issue becomes that Colombia has exhibited all of these points of view in one point or another, making the laws very confusing to understand. They have exhibited prohibitionism in some international treaties and abolitionism in some court hearings and rulings. And furthermore, before the 1900s, sex workers was completely prohibited in Colombia. And although there has been progressive acts that have drastically improved the lives of sex workers, a gap remains between the health, labor, and human rights sex workers are endowed when compared to other occupations. For example, there are no public policies that mitigate professional risk for the sex workers specifically in the sex industry, and there are no policies that guarantee their health care. For migrant sex workers, most are not registered, and many work outside of these tolerance zones and can be fined by the police. They are exploited due to their unregistered status and are targets of discrimination from Colombian sex workers who believe that the Venezuelan sex workers have destabilized the sex work industry. So how has this impacted migrant sex worker healthcare? So for unregistered migrants in general, the only healthcare that's guaranteed in Colombia is for pregnant women, children under 5, and those needing an emergency. The decision of what is considered an emergency at the end of the day is made by the providers and the hospitals. And considering that in present day, most people in Colombia view sex work negatively, this could lead to denial of care due to discrimination. This is an important point considering that xenophobia against Venezuelans has been rising in these recent years. So Venezuelan sex workers must deal with rising xenophobia as well as sex-negative prejudice that sex workers have historically been the recipients of. Furthermore, it is not mandated by law that sex work employers such as brothels provide health insurance to sex workers. So considering all these problems, I did an international comparative analysis focusing on countries with similar problems, analyzing their solutions, determining their efficacy, and I then modified and proposed solutions in order for them to fit the context in Bogota. In the analysis, I focused on the three issues that inhibited migrant sex workers' access to healthcare the most, and which were lack of information, stigma, and xenophobia. So I'm just going to tell you guys a few examples of what I gleaned and learned from these analyses. So a big question for sex workers all over the world is whether they should disclose their professions to their providers. In Canada and New Zealand, studies showed that disclosing actually led to a better patient-provider relationship, especially when pop-up clinics were created specifically for sex workers. In Iran, however, the stigma against sex workers is so pronounced, they weren't even using pop-up clinics provided or disclosing their profession due to fear of persecution. So we see that destigmatization campaigns are needed in Iran before the benefits of disclosure can be seen. Mexico is probably the country that is most similar to Colombia in the analysis. And from Mexico, we learned that the social ideals behind policy impacts how well that policy is followed. In one study, it was shown that the decision to comply with mandatory health checkups for sex workers was out of fear of police harassment. So with this motivation, it's impossible to form lasting relationships with your providers. So let's bring it back to Bogota. How can we implement this knowledge in the Bogota context? So really, there are three major levels and themes that interact with each other in regards to sex work access to healthcare. In the political levels, we see that the policies in place impact whether or not it's easy for sex workers to get their healthcare. At the societal level, we see that the cultural ideologies present impact how those policies are followed. And at the point of care, we see that the dynamics between sex works and their actual providers are influenced by the societal views and paradigms, as well as policies in place. So my solutions address each of these. At the point of care, I propose using educational training using key influential actors in the healthcare industry. These actors will give conferences, workshops, classes that are meant to remind healthcare providers that healthcare is a human right and use established destigmatization techniques that can reduce sex-negative prejudice. Furthermore, pop-up clinics specific to sex workers should be implemented around the Santa Fe district that will serve both domestic and migrant sex workers. At the societal level, a social media campaign should be implemented to curb the sex-negative prejudice. Adapting the concept of pluralistic photography, I propose using pluralistic journalism or journalism that intends to portray sex workers in multiple ways and in different contexts in order to break down the social hierarchies in place now. Studies have shown that destigmatization is reduced when the stigmatizers see their fate tied with the stigmatized. So a hashtag like hashtag soy como tú soy or hashtag I am like you, I am, followed by a characteristic a sex worker might have besides being a sex worker would be apt to tie sex workers with the overall Bogota community. An example may be hashtag I am like you, I am a mother. Lastly, a rights-based model towards sex work policy must be implemented in Bogota. A rights-based model is one where the health and human rights of sex workers must be placed at the forefront of policy. This must be accompanied with a transformation of the ideals and values within the society in order to elevate the power of such policies. Implementing policies that mitigate professional risk for the sex industry and address mental health, requiring brothels to provide health insurance, seeing migrant sex workers as agents who can expand the sex work economy in Bogota are a few ways that this model can be implemented. And this is a statue of a sex worker in Amsterdam meant to honor sex workers, and the plaque reads, respect sex workers all over the world, which I thought was an apt image. So limitations and significance. It's important to note that this study has many limitations. First off, I had originally intended for this study to be heavily influenced by sex workers themselves, which is not feasible. Implementation of any solution should first pass rigorous cross-examination by sex work-run NGOs initially, and then through political and health organizations. It also needs to be mentioned that Colombia has already done a phenomenal job in improving the lives of sex workers in recent years, and their view on migrant integration is uncommon and integral in my study. These solutions should not be generalized and are specific to the progressive context in Bogota. And significance. This research has personal significance to me as a Venezuelan native. I often think about the future perception of Venezuelans and Venezuelan women specifically will be in Latin America following this crisis. The pressures that a huge number of migrants impose on foreign governments is enough to destabilize not only regions, but also relationships between cultures. It is the reason why xenophobia is on the rise in areas that share many values and beliefs. No one organization will be able to mitigate the cost of these disasters, but using interdisciplinary and multi-level approaches to the issues like the ones that are proposed in this project will reduce the suffering of many, and more importantly, begin to amend the cultural relationships that have been broken. Thank you. Any questions?